If you've got a lingering deep cough or breathing issue, you may have a respiratory challenge separate from but related to the flu. You've probably been prescribed a Z-Pack of antibiotics against bacterial issues, but you may have a viral challenge or even both. If due to a below-par immune response, NSC Immunition Respiratory Formula is suggested to nutritionally help positively modify your immune response. MG-beta-glucan joins with vitamin C, echinacea extract, astragalus, quercetin, and other active ingredients with antioxidant attributes. Respiratory challenges include asthma. That's suffered by more than 20 million folks in the U.S. alone, and a serious flu complication. Asthma attacks involve contraction of the muscles and swelling of the lining of the tiny airways that prevents air from flowing properly. This restriction causes wheezing and difficulty breathing. Asthma can be life-threatening, so if persisting, immediately call your physician. Bronchitis causes inflamed membranes in the larger bronchial tube linings, and that produces excess mucus. Bronchitis can bring a deep, debilitating cough attempting to remove the mucus. Many are subject to bronchitis after a flu session, and overcoming especially the cough is tough. Common colds are caused by over 200 different viruses, creating inflammation in the upper respiratory tract. Colds mean misery, often with a mild fever, cough, headache, runny nose, sneezing, and sore throat. While not life-threatening, we all want to minimize time and severity of these misery makers. Cystic fibrosis, or CF, affects more than 30,000, primarily the young, in the U.S. By usually attacking the respiratory and digestive system, CF causes mucus in the body to be abnormally thick and sticky. The mucus can clog the airways in the lungs, making a person more vulnerable to bacterial infections, often with severe coughing. Pneumonia involves inflammation in the lungs, usually caused by a bacterial or viral infection. Pneumonia causes fever and inflammation of the lung tissue, making breathing difficult because the lungs have to work harder to transfer oxygen into the bloodstream and remove carbon dioxide from the blood. Common causes of pneumonia are influenza complications and infection. Pneumonia can be very serious, even deadly, especially for the elderly. See your personal health care provider to be examined and diagnosed for individual respiratory conditions. In addition to the prescribed medications and treatments, wash hands, practice good hygiene, stay isolated with nutritional aids such as NSC 100 mg beta-glucan and the NSC Immunition Respiratory Formula, both suggested for potential positive immune cell modification. Choose well. Choose NSC.